In this video, I'm going to teach you why cash physical therapy practices are perfect for capitalizing on remote wellness plans. My name is Dr. Joe Camerata with Across The Continuum, and it is my goal to teach you to be a better strength coach as a physical therapist. Now, you're very aware that wellness is the aftercare that people get once they are done with the rehab or the physical therapy part of physical therapy. You want to transition them to a wellness plan that incorporates things like recovery, like performance, and like pushing towards health goals that are outside of that rehab scope. Now, a lot of physical therapy clinics already have wellness plans, and what that usually looks like is they have the patient come into the clinic and do things around the clinic that have to do with stuff like recovery or like getting in shape, or they'll outsource it to personal trainers or strength coaches. Now, there's a few reasons that cash physical therapy clinics are perfectly set up for remote wellness plans. First and foremost, you are already providing a customized and intimate service to a person who has self-selected themselves to want a higher standard of care than they might be able to get at a mill clinic or a regular physical therapy clinic. Those people who have self-selected themselves for a higher standard of care are also paying a premium for that standard of care and for that one-on-one FaceTime with you as the physical therapist. They've decided to invest in their health and wellness with that premium and with that one-on-one time because they could get physical therapy in any of the 100 physical therapy clinics that I'm sure your city or region has, but they've chosen you for a specific reason, and that's that attention that they get from you. Not only are you providing that intimate and customized experience that this person is getting one-on-one, but this person is also self-selecting themselves to pay more money for that sort of care. They're investing in their health, they're investing in their wellness, and they're choosing with their dollar to go to you even though you're more expensive. But that's the beauty of this situation, is that those people have already selected themselves to pay more, to invest in their health and wellness, and to look outside of the box when it comes to physical therapy care. Now, if we linger on prices for a moment, the prices that you're charging as a cash physical therapist are likely to be conducive to downselling them to a cheaper but more valuable remote wellness plan. Now, what I mean by that is that you're likely charging anywhere between $100 to $300 per session when it comes to this one-on-one cash physical therapy. Now, when I work with cash physical therapy owners to install this remote wellness, I usually coach them to charge at least $200 per month when it comes to installing this remote wellness plan. And so you can see the difference between having somebody pay anywhere from $100 to $300 per session multiple times per month and downselling them to a once a month cheaper version, but where they get more contact from you because we are going to be giving them a nice periodized exercise plan multiple times per week. So the big question is, why remote wellness? As a cash physical therapist, I'm sure that you remember the days where you worked in a non-cash based or an in-network clinic and you were seeing anywhere from 2 to 4 patients per hour. And when you went to that cash PT practice, when you opened your own cash PT practice, I'm sure it was a blessing to see patients one-on-one. You had as much time as you wanted. You could spend over an hour with them, and there was nobody breathing down your neck for seeing other patients. Now, if you've had the good fortune to fill your schedule in your cash physical therapy practice, then you've realized that there's only 24 hours per day, and seeing patients one-on-one just isn't gonna cut it anymore when it comes to growth. There are a few ways to make more money when it comes to cash physical therapy and seeing patients one-on-one. Number one is charging more per session. Number two is shortening your sessions to fit more in during a day. And then number three is hiring somebody else to see patients while you are also seeing patients. While all of these are great ways to grow and scale your cash physical therapy practice, we can push them down the road and offload the need to do any of those by simply adding on a remote wellness plan in a membership basis. Essentially, we're gonna leverage your hour. The idea is that before you're seeing 1 patient per hour or maybe even 2 patients per hour, but now with a remote wellness program, what we can do is we can see multiple patients per hour. Now, when I say see, I mean we can manage their programming and manage their coaching on an online basis without them actually having to come into the clinic, take up our time, take up our resources, and take up our room in our clinic. What that's gonna do is clear up room in your clinic for the folks that actually need to be there, who really need your in-person attention, and move those people that might not need as much attention to this remote wellness plan. Once you get really good at coaching and programming, instead of just managing a couple of clients per hour, you can manage anywhere from 10 to 15 people per that hour, and you can imagine how we can scale that when it comes to adding in multiple hours to our equation. When it comes to the actual meat and potatoes of installing a remote wellness program, there's only a few things that we really need to do, which is what makes this so simple and so great for the busy cash clinic owner. Number one is you need a means of delivering that remote product, basically a portal in with which to interact with the person remotely. Now, the platform that I like to recommend the most is called TrueCoach. They do a great job as far as just having a simple experience when it comes to writing programs, to delivering that to the person. Their app works great, the coach-facing one works great. It's cheap enough and it gets the job done for what it is that we need. Now, the second thing is we need a means for collecting an electronic payment on a subscription basis, preferably. Now, if you're an established physical therapy clinic, you likely have a way to accept electronic payment, but a lot of folks overlook the utility of having a recurring and automatic auto draft so that we don't even have to have any friction when it comes to continuing the membership. Now, if you already have one, that's great. And if it has that subscription functionality, that's great too. But if you don't, I always push my clients towards Stripe just because of ease of use. Last but not least, you need a list of people to pull from and sell to. Now, the benefit of how you're already set up as a cash physical therapy practice is that you have a list of a warm audience, mainly those patients that you're currently seeing or that you have seen in the past. Now, they're a warm audience because they know you, they trust you, and they like you. Not only that, but they've already paid you a substantial amount of money. You have helped them get back to their life and the meaning that they take from their life. And you've already built great rapport with them because I know as a physical therapist, you're really good at doing that. And the great part is if you've done a good job with all of those, then they are gonna be asking you for more stuff at the end of their care. And lucky for you, you now know that that extra stuff can be a remote wellness program. So now we know that the remote wellness program is the way to scale up your business without actually needing to do all the hard stuff like hiring extra people or doing extra marketing. And you also know that there are only a few steps that it takes to really get started with this. Now, in the end, what this does is it allows you to manage multiple people's wellness all within 1 hour. Now, if we extrapolate that single hour, you can see how this compounds and we can manage more and more and more patients' wellness with those hours. So much so to the point that you might even work yourself out of the clinic or a few days out of the week, depending on how much you scale it or how much you really want to scale it. And remember, when you get good at it, which is learning periodization, learning how to write programs, and learning how to give effective feedback and coach, that number per hour grows more and more as you get better and better. And then as you have more time on your schedule, you can see more people on the front end, effectively helping more people in your community, creating a larger warm audience, and opening up more people to convert over to that remote wellness plan. Now, if you want all of this in text form, I'm gonna go ahead and link down in the description the free guide that we built as far as putting together a remote wellness program and implementing it at your clinic so you can go through all the steps as quickly or as slowly as you need to and implement them as well as you possibly can. If you need any help with any of the implementation, let me know. I'll go ahead and put a link down in the description as well for booking a call with me so that I can give my 2 cents or help you and hold your hand while we implement this together. If you found this content helpful, please share it with other owners of physical therapy practices, with your coworkers, or with anybody who you feel like needs to hear this message. And thank you so much.